professionals to blame the doctors, saying they are very poor in using technology. They don't like it. They are so used to delegating, and even from a technology standpoint, they kind of pretty much delegate. But I think that's passé, because we are seeing the new generation of doctors who are just like us. They also have the Sunday night experience and the Monday morning experience. They like to have better Monday morning experience than what we are seeing in these days. And I would say that the IT industry, I think we have to take the responsibility in literally enabling even those who were not interested in literally in using IT to be wanting to use it when they see their juniors, literally leverage that to the fullest extent. Not just from, showing off a flashy gadget, but really understanding the ability to use knowledge, ability to really not really have to remember every single nuance of a disease or a, or a treatment, but really be able to know where they can get it from, and be able to use that for the betterment of the patient as well as the whole industry itself. So I think I spoke on most of these, but literally that's what is trending in healthcare IT, as you see. Social media, the patient and the patient collaboration that you would see there. In mobility, the whole physician-directed apps. There are a lot of interesting bedside applications that have now started coming up. In the US, I understand that the regulatory body called the CMS is actually trying to see whether they need to start penalizing payers as well as providers for early discharge in case somebody gets readmitted within a few days. I think that's a great step, because then you're literally not trying to cut corners in the treatment of a patient, but you're also making sure that the patient is also into a good adherence regime. Because many times what happens is when a patient gets discharged and gets a bit long discharge summary along with the set of medications, I think the whole act of taking those medications stops pretty much at the doorstep of the hospital. And then when they go home, they like to live their own lives without being disturbed for taking medications 3 times a day or 4 times a day. And they get readmitted very soon. And then the cost of readmissions is so much higher than the cost of adherence that they have to make sure the patients have. So the whole act of getting the whole discharge summary at the retail pharmacy and making sure that the patient gets all the medications in hand and then is adhering to that whole treatment regime is something that is a big ask and a big task for all the for the pharmacies and for the hospitals. So these days, these whole mobile applications on iPads, I think they're literally able to go to the bedside of the patient, get all the data, and then they're able to use good electronic media of communication literally to pass it back and forth to the patient so that they are able to adhere to this regimen and reduce the number of readmissions that they are seeing on a day-to-day basis. Cloud applications, I think is I hope you guys are familiar with the terminology of cloud, and that's something that is picking up still in the healthcare world, especially in the US and Europe, and it's not so much in India yet, but I think it will soon catch up, is the whole world of security and privacy. And that is something that has literally stopped a huge adoption of cloud in the healthcare industry. But I think the industry will figure out ways to get over that hump, and we would see some more broad-based adoption on cloud, literally for non-core systems at least, and then for the core systems as well, when consent and consent from the patient on usage of their data for certain things is accepted, and then the whole total cost of ownership of IT systems will start going down because of the shared infrastructure that will be used through the cloud computing world. We spoke about the patient self-service tools already, and I think that's a big area that's trending as we speak. And the point of care information access, as well as to the ability of the patients as well as the caregivers to be able to access information and knowledge at the bedside itself. So it's a great picture of one of the use of broadband on senior citizens. I can probably share this slide for you, or you can look it up. Department of Human and Health Services that literally says how the whole patient care can be made possible. We know that a lot of telemedicine systems are currently in use, especially in the far emerging markets, as Dr. Ratnakar put, the markets that really do not have a large doctor penetration population in the rural societies. Telemedicine has become a big imperative, literally. Companies like Cisco and other companies like Huawei and all have gotten into this act where they're able to provide extremely clear such equipment where the doctors are, going to be, feeling literally as though they are with the patient and be able to consult from a remote location, and hence provide some amount of access and availability to the patients from wherever they are. So that kind of similar scenario you see even in the US senior market, where you have a lot more earlier, accurate, more diagnostics that can be made possible through technology and IT, and make sure that there's real-time treatment. While I don't know whether doctors accept that too much information is good or bad, today's technology kind of makes it possible for patients to literally relay their health parameters pretty much on an on-demand basis, you can call, whether it is every hour or every 12 hours or every day, and that can be uploaded onto a cloud or onto a system, and doctors can have continuous access. It's pretty much like being in an ICU all the time, where every parameter of yours is monitored continuously, and any deterioration in your state can be immediately handled by the doctors. But I don't know if it's a great thing in India, because we still have the whole inverse proportion of doctors to patients number-wise, so that whether they'll have the time to really look at so much of data. But I think as we improve, and hopefully with all the National Rural Health Mission objectives being met in the next 5-10 years, those are some things that we can really use to improve again the quality of life, especially for chronically ill patients. So what are the challenges that we see from an IT perspective? There are many challenges, of course. We have and I think that's the great thing about the industry, because these are challenges that lead to opportunities for us. A lot of integration that is required across the different stakeholders that we see. Some of them are obviously trying to, India, I think we are still bogged down with the lack of a standard in interaction between systems. Maybe there is HL7 that is being adopted among the provider world. Some amount of DICOM, maybe not because of India having a regulation, I would think, but more because most of the systems that we buy are more international and global, and they already are complying to those standards. But for interaction between the stakeholders in the country, whether it is what we call as in the US world as HIPAA transactions or EDI transactions, you really do not have such a standard here, and hence how the various entities interact with each other, it becomes a challenge, because then you have to code and decode each other's formats, and really waste a lot of money in trying to just make something readable as the data that you get from each of these entities. So that's something that is a great, actually it's an important activity as we speak, what we call as integration or system integration, but that's something that's a wasteful activity nevertheless. But at some point of time, hopefully with all the standardization coming to bear fruit for us, I think that will come down over time. Security and privacy, that's I think a big challenge as well. This is something that is very prevalent in the Western economies. Patient A is not supposed to be able to look at any other person's data except his or her. Nobody else should be able to look at patient A's data unless A has consented to the use of that data. So when that is the case, a lot of restrictions have to be created in the IT systems to ensure that there is no malicious intent in use of data, in use of private personal data. I think the whole country, I remember, woke up and did not like when Sonia Gandhi went to US, and none of us knew what went wrong with her, right? But I think she had a right to privacy, and fortunately for us, she was in the US, and if she were treated in India, I'm sure all of us would know exactly what her DNA mapping would have been. But because she was able to go there, I think the whole country respects the whole act of privacy and security of the data. We didn't even know which hospital she went to, if you realize. I mean, there was a lot of speculation, but I don't know whether that is true, or whether she went to any of the hospitals there or somewhere else. But that's the need of privacy and security, and IT systems also need to cater to that requirement. And also you'll see that some of the corporate hospitals in India, especially where you have medical tourism, you will see doctors and hospital personnel carrying wearing tags saying they're authorized carriers of personal data or PHR data or something like that, which is something that's a good step in the right direction. I think it's more self-regulation rather than being regulated by the government itself. We spoke about collaboration and standardization, literally the need that should come over time. There's a cost as well. There's a lot of cost in healthcare which needs to be due to the systems that have to be implemented. Hospitals in India are still looking at, I mean, it's quite common. Hospitals worldwide actually implement a lot of products. The product implementations are very expensive, and they're not just implementations that are expensive, the ongoing upkeep of those systems is also extremely expensive. And a large capital outlay needs to be made to be able to have those systems online and be able to leverage them on a requirement basis. So that is also another driver, because you want to see how to reduce cost but still have all the capabilities that these IT systems need. And then of course the ease of access. You would like to be able to access these systems at any time, anywhere, literally being able to look at it literally from a doctor's perspective at the patient bedside literally, and leverage and make the best use of their data so that they can give the best care to the patient. So what are the opportunities that we have from a consulting perspective, an IT consulting perspective? Reading this chart from the 2 o'clock position on strategic IT consulting, you would have a lot of work that can be done through strategic IT alignment work. As you know, you would have graduated being able to do a lot of analysis and number crunching and being able to figure out balance sheets and a lot of things like that. So there's not naturally a lot of alignment that you will see in how to create those roadmaps, how to understand and create an IT strategy roadmap for your provider clients, for your payer clients, especially because in the India market they are pretty nascent in their whole adoption of IT and being able to use them for their systems. There's a lot of from a Western world, if you see, they're besieged with a lot of systems. They've had mushrooming of systems, I think, for the last 20, 30, 40 years, and naturally they've not thrown away any of their systems which they started with. And there's an opportunity to rationalize those systems, because you really don't want two membership enrollment systems or two claims reimbursement systems. So you would like to really rationalize them. So that's a great consulting opportunity that comes. Similarly, there are a lot of unification opportunities that come, because you would like to bring down same instance of SAP that may be put in 7 or 8 instances in a given organization, and bring it down to a meaningful number of 2 or 3 and be able to leverage them, especially in large organizations. So you would like to see how to unify different systems. Process consulting, that's a great area, because processes degenerate over a period of time. You really need to re-engineer the processes and make sure that they're right for the current business model that is applied by the company. So you would have good opportunities there as well. There is IT infrastructure. That's a great area, because given the pace and the velocity at which we are seeing the change in this IT infrastructure, you would always have the opportunity to relook at what you have today and how you should be positioned for the next 5, 10, 15 years. So that's a great area of infrastructure consulting that you would be able to do, especially from an IT perspective. Product consulting and assessment, whether you would like to go build out a system on your own, or whether you would like to buy products that are available and just integrate them to your existing area. So COTS, build versus buy analysis that you would do would be a great consulting opportunity as well. And you have, of course, analytics. I like the whole set of slides that Dr. Ratnakar put. A lot of them were from IMS Health, if you saw the footnote. And it's a great place where you would have, the huge amount of data that they, collect. They're able to analyze and also be able to report and give actionable information. That's exactly the same thing that you would do in any company. The moment you have a lot of data, you would like to be able to analyze it, come up with really meaningful reports, and also actionable reports to your management, so that they can really take action and see what can be done. Whether it is with respect to figuring out whether there's excess claims versus the premium paid, or whether it is too much of consumption of care for a small outbreak of a flu or a big outbreak of encephalitis. You really would like to figure out how to analyze the data that you have, because you'll be sitting on tons of data. Literally, I was just reading up some data on the amount of data generated in hospitals, especially with the better equipped, IT equipped hospitals, which have a lot of PACS systems and generating multiple images and scans. I think each, it's probably, we are going to be flooded with a lot of big data, unable to use them literally to the best of their abilities, unless we figure out a strategy of how we can leverage and tap into that, mine them, use the right tools. And because today, even for handling big data, we have a lot of good tools that are coming to the market that we can use to figure out whether we have the right information and leverage that information. So overall, a variety of opportunities, and of course, the whole regulatory compliance area. I think I left the 12 o'clock position, which is regulatory compliance. And I think that's something that, while India is still catching up, I think the rest of the world is quite far ahead. And that gives a huge opportunity to enter into the healthcare market wherever you are and understand the systems and then go ahead and build further expertise on each of the areas that those systems can give. So overall, I would say that you will have a great sense of opportunities from an IT consulting perspective, because all of these lead to pull through work, whether it is in modernization of systems or whether in building new systems or implementing some products, variety of activities that have their own chain and life after the consulting activity that is done. So it is a great industry that you have, where a variety of drivers, variety of opportunities exist to leverage the skills and talent that you would build over these 2 years. So I thought with that I'll just wrap it up with just one slide on Cognizant Healthcare. So where we stand today, as you would be aware, Cognizant is a large US corporation as we speak, slated to clock revenues of about $6 billion this year overall. More than 25% of that comes from healthcare, which is about 1.5 billion plus as we speak. We cater to the whole spectrum, literally the whole continuum of healthcare: payer, provider, pharma, life sciences, biotech. There is a new industry in the US called the PBM industry, which is the pharmacy benefit management companies. There are intermediaries, there's government. Then there are product companies that cater to each one of these whole areas. So we pretty much cover the entire spectrum. And there are new companies cropping up, like the wellness management companies, the disease management companies, the care management companies, the retail clinics, as we see them. There are specialty pharmacies. These are all the new upcoming industry models that we are seeing literally in the healthcare space. And pretty much to each of these areas, Cognizant caters in building out, pretty much they're from consulting, IT, infrastructure requirements, BPO, the whole works that you can see in the services space there. So we've got 25,000 plus associates who are in this practice. We have, in addition to people who are, qualified MBAs and qualified doctors, nurses, biostatisticians, as we saw, and of course IT professionals. We also have got them trained on healthcare, because the world of healthcare is very different in each country. We have a huge US market and a big European market as well. So we naturally need to train them on those areas and make sure that they get to understand the basics of those respective healthcare systems and be able to contribute in the IT perspective. Multiple clients, some of the leading brands, leading healthcare payers, providers are our customers. 15 of the top 20 health plans, 27 of the top 30 pharma companies in the world are literally our clients. And we cater to pretty much most of their needs from an IT, BPO consulting and infrastructure services perspective. We are ranked number 10 among the HIT vendors across the world, and that's something that among the top 100 literally, and I think is the highest ranked Indian offshore company literally to be in that space. So with that, I would say that we also have, I just thought that I'll add, we have a consulting practice which is called the CBC Consulting, Cognizant Business Consulting, which pretty much takes domain experts in different areas, including healthcare, and deliver on consulting projects for our customers in these respective domains. I thought I'll add just one more point to the things that Dr. Ratnakar as well as Dr. Shripati Rao said. We also have a very strong Cognizant Foundation, our corporate responsibility arm, social responsibility arm, and a couple of mandates of that arm are towards education and healthcare, the main mandates actually. While the foundation actually contributes funding to these initiatives, the associates of the company, basically the employees of the company, actually give out their sweat literally in making sure that these mandates are taken forward. So there are multiple schools that the company has adopted. We adopt schools pretty much in the neighborhood of where our offices are. Most of them are government-run schools, and try to make sure that we give them access to good sanitized water, literally as we would call it. We give good drinking water in the schools. We make sure that they also have good computer, labs. Their facilities are, to the good standards. So education, so that we also try to do some analytics on the impact of our outreach to these schools to see if the results of those schools in the government exams have actually gone up. And to our satisfaction, we realize that that's something that has happened very well for us, and most of the schools have had excellent scores in math and English, which is what we have actually focused on for them. so that they can actually become better students as well as go further in their education. Similarly, on healthcare, it's a lot of, healthcare is a largely corporate funded activity because it means a lot of donations of equipments and capital outlay that goes from the foundation. So that's something that, that we continue to do as a, as a good corporate citizen. So with that, I'll try to open it up for questions. I think pretty much running out of time. If you can take a few questions, yeah.
Good afternoon, ma'am. I am Sudhanya Chakravarti from PGP2. I have a question about the section where you mentioned that in Europe and US, the healthcare is majority covered by the insurance and paid by government, and the expenses are mostly paid by people in the form of taxes.
True.
But in India, we don't have that structure. And in both the economies, we face the problems. So what would be the ideal solution for this problem?
So there is, I think it's the gravity of the problems that you have to look at, right? What are the problems in India? Is the whole lack of access, lack of doctors, whereas it is not the same with respect to the Western economies. It is the need for, I think, the right decisions. Who gets the kidney when it is available? Is it a 75-year-old patient or is it a 35-year-old patient? Those kind of choices that those governments have to make. So that's a problem, nevertheless, but somebody has to make those right choices, right? Whether a doctor or a government has the right to make those decisions on life. Is that right? Or whether it is something that the patient gets to make, or whether the paying system has to make, right? So you would like to look at the return on investment, literally. I think by default, some of those economies, I think, would go with a 35-year-old patient rather than with a 75-year-old or an 80-year-old patient. Whereas in the US system, that choice is not allowed. I think it's on a first come, first served basis. And that creates problems because you might be giving a kidney to a 90-year-old patient who might die after a month or two, whereas a 35-year-old still will be languishing without a kidney donor. So those are the kind of issues. So the kind of challenges are very different. It doesn't say that you will not have challenges once you move to a Western type of an economy. You will still have, but the challenges will be very different. And I think there will be more refined challenges, as I would call them, than the day-to-day basic needs of healthcare.
Good afternoon, ma'am. Myself, Pankaj Yadav. You talked of ICD-10. Not long back, I was reading something on ICD-10, which mentioned that government itself is taking a lot of efforts in order to make information available. And my question to you is, how and when do you think that our country will be fully compliant to these ICD-10 regulations? Because, of course, it's an important. ICD-10 is quite important, and basically. Having information available is is very crucial for us. Right. So what do you think about it?
Sure. So good question, actually. If I realize that US is actually in the big whole swing of converting from ICD-9 to ICD-10, and the dates have kept changing, and now I think the compliance date is 2013, by when they need October 1st, 2013, by when they need to be compliant. Now, there are multiple things you can do for compliance. You can just manually blindly look at just moving from 9 to 10 without being able to leverage the great qualities that ICD-10 has to offer. We know it's not a one-to-one conversion, as in it's not a one-to-one relationship between an ICD-9 definition to an ICD-10 definition. We've seen many to ones, many to manys in the ICD-9 to 10 conversions. So you will see that if you are able to leverage all that ICD-10 has to offer, then there will be a lot more things that the providers, that the payers can actually do with the data, mine more with the analytics that, that these code sets have to offer, and come up with better, solutions to the issues at hand. From an India perspective, as I understand, most of the rest of the world actually moved to ICD-10 long ago, almost 10 years ago. I don't know how well they have actually leveraged it, because, that's probably the challenge that this economy is facing. I would think that that's just one aspect of standardization, ICD-10. There are a lot more aspects as well, because the number of claims that you see going to insurance companies through this, disease, coding that will be done on the claims, etc., is much smaller than the whole universe of claims, literally, or the universe of encounters that you might have in the country from a hospital perspective. So there's a lot more to be done, I would think, from a prioritization perspective in this country, ahead of even ICD-10, though many of them will have to go hand in hand or have their own parallel streams to achieve the kind of standardization that we need. But it's a very important activity, because that's something that would help literally leverage the richness of the data that you will have through ICD-10.
Ma'am, myself Pooja Agarwal from PGP2 Healthcare. Ma'am, I wanted to know as what services Cognizant Healthcare provides in medical equipment sector, like except CRM and databases.
So medical equipment sectors, you will see it actually typically comes in the life sciences and product medical devices companies. So those companies have systems that are required to keep literally from the birth to the death of a device, literally as we call it, from being able to track how they have been created, what their whole maintenance is, especially for devices that are small in nature, like your injectables or whatever that need to be given, versus large equipments that need to have their whole record of maintenance and make sure that they have. It's like keeping an airplane perfect, right? Even these systems have to be perfect on a day-to-day basis so that the patients get the right information. So there is IT systems. There are IT systems that actually help in the upkeep of these maintenance records. There's also, from a main device company's perspectives, if you see, their whole procurement for the hospitals is through themselves directly working with the device companies or through other channels of distribution that come through the wholesalers. So there's a lot of rebate management that needs to be done. So those kind of activities that between the supplier as well as the hospitals themselves. Variety of course there is the whole corporate systems of HR, finance, procurement, legal, all that as well that you will see. But variety of, I think I would say that being able to track these devices on from where they are to where they've been left, I think is the most important activity that would be needed from a device company perspective. But I'm sure Mohan will be able to add a little bit more later, given his background in that area.
Ma'am, as we know, in India there are very less companies who manufacture high-end equipments. There are very less companies who, the only companies who provide supplies and low-end equipments required for hospitals. So like how is, they can give me a focus as how this will affect, or how is there improvement in such equipments coming up in India?
So I would think that there are companies currently doing partnerships and alliances with international device manufacturing companies. I would say that instead of reinventing the wheel in these areas, it's better to adopt what others have already built and be able to buy them. Maybe we would need differential rates that the Indian economy can afford to be able to buy these equipments for the hospitals. But I think most of our good hospitals have actually equipped themselves with most of these equipments. Good equipments that you can see overseas are pretty much there in many of the good corporate hospitals in India as well, and some of the government hospitals as well. So you will, I don't know whether there'll be a market trend towards actual manufacturing of these devices in the country, maybe to a small extent, but I think there'll be a lot more that you will see in the import, and I think those are other IT systems that will have to enable that import and taxation and all those activities that will be required, which will have its own life literally in that area. So it will take some time, I would think, and I don't know whether the government is